Can an employer escape? No. The government says, yes, we can do it to you too. The Comprehensive Workplace Wellness Program, I didn't make that up, shall include initiatives to change unhealthy behaviors. Policies, it'll include policies to encourage healthy lifestyles, healthy eating, increase physical activity, and improve mental health. Now, these aren't made up by the employer, they're foisted on the employer. And why would an employer do that? Well, the employer doesn't really care if it's kind of burdensome to you, if he gets some kind of tax break, some other kind of incentive, whatever it is, to implement it. Does he? No, he doesn't. Why should he? I mean, it's you. He's him. So.
We couldn't call our employers and tell them they're
a lot of them
don't
don't know this, so it's not as nefarious as I say on their part, but the fact of the matter is it's how it works. The employers are uneducated about this, just like everybody is, because it's impossible to know all this. The employer, you say, the director shall, this is the director of one of the sub-agencies, I think CMS, provide employees assistance to impact employees' health behaviors and healthcare expenditures. They want to impact how much you spend and your behavior on how you do it. And guess what they're going to do to the employer anyway, no matter if it works or not. They're going to give them a survey, and the survey is going to take a lot of time and cost money at the employee's expense. And guess what? You think they're going to ask how much they pay to have their lawn mowed, or if they just had markings on their building updated? It's information about you. And they have to fill out that survey so they get the money. Okay. If you're an insurance issuer, they say, yes, we can make you do it too. If an insurance issue provides coverage, he has to do it with no cost sharing for evidence-based services that have a rating of A or B, according to the government. And evidence-informed, I put that in quotes because I don't even know what that is. Does that mean they actually researched it, or did it just pop in their mind that they're informed? That wasn't clear. Evidence-informed preventive care and screening in the Health Resources and Service Administration, HRSA, under the Health and Human Services. It's an agency under that. You would never know all these acronyms. It took me hundreds of hours to get it straight, and I probably got some of it wrong, but you'll never know. Adverse effects on patients under ObamaCare. So coming into some of the interesting stuff. I think it's all interesting. Multiple problems for the patient: loss of privacy through collection of information and loss of choice over your health care. You won't even know you're losing that choice, because how do you know what choice the doctor was going to give you if he doesn't give you a choice? Well, okay. Information related to health disparities will be shared with relevant federal and state agencies. It doesn't limit it. I put that in because it says relevant. Well, let me ask. Shout it out. Who decides if it's a relevant federal and state agency to get that? Of all the people and everything, who do you think is going to decide that? It's the secretary. The secretary of the HHS. If she thinks it's relative and wants the information, she gets it.
How is she going to decide all this stuff?
Actually, it says the secretary, but that's why they have thousands and thousands of people working under them. I believe the CDC has 2,800 people. I believe. Information will be collected from the directors of the Office of Personnel Management. I don't know where that is. The Census Bureau, although the Census Bureau website says they don't share it with anybody or any agency. With the Secretaries of Defense, Secretary of Veterans Affairs, Commissioner of Social Security, other federal agencies, and other federal agencies, as well as physicians and patients themselves. That means not your physician, he already knows about you. Any physician that they want to tell anything about you, for whatever reason, gets to know about you. Even if you don't go to him, ever. I'm getting a little too passionate. I'll calm down, Debbie. Okay, adverse effects on the physician. This, does anybody have, excuse me, just one second. I didn't even write all this because this is the most interesting. And you would tend, before this talk, to have thought this was not the most interesting because basically, who cares about the doctors? I mean, I don't take it personally. Who cares about those big companies making a lot of money? Who cares about gun rights in this instance? I mean, come on, this is a health care bill. Did you know that there's a section in there specifically put in by the NRA? They put it in there because they read the whole bill, and they're not stupid. They have teams of people to do it. They didn't have to spend hundreds of hours each, like I did. They have teams to read it, and it didn't say anything about gun rights per se in the bill. But they could tell that all the reporting requirements would lead them to have to tell the government if you had a gun, if you had information, ammunition, if you kept it locked. Oh, how can they do that? Well, they would say, yes, we can. You know how they do it? Anybody know how they get that information? Why is that health information? Because sometimes kids accidentally shoot themselves with guns. So on every gun, you need to know if it's locked up. You need to know who owns it. You need to know if there's ammunition. You need to know if they've got any counseling on it being safe. How is it locked up? You have to ask these important gun questions because it's a health issue, isn't it? Well, so they read the bill and didn't say anything about gun rights in it. And they put two paragraphs in there specifically excluding a whole bunch of things because they could see the handwriting on the wall, just like I think it's starting to be clear to a lot of you. And then they got their way, they got their two paragraphs. Does anybody remember if the NRA was for this bill or not? Well, I'll tell you, they were against the bill till they were for the bill. Did you know that? You know when they became for the bill? When they got their exclusion. They read this whole bill pretty much to find out, knowing that it gave so much power to the government that you could just see what was going to happen. So they excluded themselves in two paragraphs, very technical, very specific, and said, we got our way, screw all the rest of you. With your First Amendment rights, with your parental rights, with your personal privacy, with your individual liberty, with your choice, we're just sticking up for our gun owners. Well, I don't belong to the NRA. I might have, but I belong to the Gun Owners of America instead. Anybody else here that harms has guns, I suggest you check out the Gun Owners of America. It's not one of those becoming leftist organizations, or already is. Okay, but the information on physicians, I need to just go over a couple things. It's in this handout, but I highlighted it. There's 30 of these handouts. If you didn't get one, ask Dodie, and she can email you, and you can print it out at home.
When my computer comes.
When the computer comes back. Like the thing on provider screening and these 5 pages. These 5 pages probably took me no less than 40 hours to summarize.
Do you have the slide presentation? Can we get that somehow?
It ends right there.
No, I mean, get a copy of
but,
the entire slide
I'll have to talk to Josh. If I did that, I'd probably do it on that site. I don't have a site or anything yet of my own for anything. But I'll get back to you. Okay, now, here's the things that they're going to do to doctors. And I say some of this because, again, the way that they're going to get to you is through the doctors, because they got a hook in the doctors because they can hold money out of them and incentivize. You know, I don't like that word. Most people say it's a good thing, and when they hear it, they don't think it's a bad thing. If you hear the word incentivize, you're talking probably to a leftist if he likes it. Okay? Anyway, here's what they're going to do to the doctors. They're going to have you're going to have to be screened to get into Medicare. And I'm going to go over these in about 10 minutes, then I think we'll be done, and we'll take some questions in other areas. But they're going to do a licensure check that may include a criminal background check, fingerprinting, unscheduled and unannounced site visits. Yep, yeah, you've seen a patient, get the heck out here, I got to talk to you. Database checks, any database checks where you might show up, and such other screening as the secretary determines appropriate. This is great. They're going to disclose, you have to disclose as a physician, this has got to be unconstitutional, by the way. Follow this closely and tell me if you think it sounds unconstitutional. You have to disclose any current or previous affiliation, directly or indirectly, with a provider that has uncollected debt. So if you are in a group and you just join Amherst Family Practice and they take Medicare and they bill under a certain number, a TIN, a taxpayer ID number, or an employee EIN, employee ID number, you sign on, money comes into them, gets given to you. You have your national provider ID, which is unique to your doctor. So, but they have money come in, and you don't know this, but one of your doctors in the group, he's got a lien against them for a tax issue. It doesn't have to be legitimate. There is no judicial review of tax things. They just can like seize assets and close you up on their say-so. You all knew that. I'm sure you all knew that. It's how the IRS works. It's not a court thing. It's outside of that, at least to start. So anyway, if a provider that you don't know owes some money and you work there, that's an indirect relationship, and he has uncollected debt, or if he's subjected, this bad doctor is subjected to payment suspension on any federal health care program, or has been excluded in the past for any reason, or had his privileges denied for any reason, then you, that is me going down there and joining Amherst Family Practice, I just may not get my Medicare because that may pose an undue risk to society if I start working there with a doctor that hasn't paid his tax bill. So I, who have nothing to do with it, don't get to sign up for the program. Does that sound constitutional? Does that sound like due process to you, anybody? Okay. Okay, it goes on though. If I do join and they let me, and there's a bill and I don't know about it, they can make, quote, adjustments to payments to me, adjustments in my money, in order to satisfy the past due obligation of that other doctor. Now guess what? You get paid monthly. I'll work for a month, I'll get a lot of billing amount coming in my name, of which 60% is overhead for an average family practice doctor. And guess what? After a month when I thought I was going to get $10,000, which is $4,000 to me after the overhead's out, guess what? I got zero. It all went to pay off that other doctor's debt. Does that sound like due process to me? One other thing. This applies to anybody that has the same taxpayer ID number, like Amherst Family Practice. I have my own unique identifier, but it says, too bad, it's regardless of whether the applicable provider, Dr. Berg, is assigned a different national provider ID number, and we know he's not involved in this. That's too damn bad. He's working where somebody else didn't pay their bill, we say, and Dr. Berg is going to have to pay. But there's one last stake in the heart of it. It says the administrator of CMS services shall make available to each agency administering the state Medicaid plan or the CHIP plan, make it available to all of them my name, my national provider ID, any other information about me from any database, so that, guess what? You think I'm going to be able to get on any of those things? Do you think, anybody think I'll be able to make a dime? How many patients will I have? I'll tell you, I didn't take insurance, and the reason I closed my last office is because I didn't get enough patients. I was going broke. I had one patient over 65 that came and saw me because he liked me. And I had a lot of people that liked me, and a lot of people, not a lot, but I kid you not, 3 people out of my relatively small practice said they would pay my malpractice, sight unseen, didn't know how much if I would just stay practicing.